welcome to all of you who have come to this program today that's presented by the Low Vision Hearing Challenge Committee. Some of you may have been here on Wednesday when our speaker, Priscilla Hung, talked about ways we can accommodate if we have hearing challenges. And today she's going to talk about ways we can accommodate our units if we have vision challenges. Priscilla worked as an occupational therapist here at Horizon House, but when that job went away, she's moved on to other adventures, and she'll tell us about that. But she's gracious to be here with us today. And I need to warn you that they're drilling near here, and suddenly we're going to get these large noises, and it's just part of life at Horizon House these days. But fortunately, we can read a lot of text, and you'll be flexible. So thank you for coming to be with us today. I look forward to learning from you.
Thank you. Oh, I have this one.
Okay.
Hello. Thank you for the introduction, and thank you for having me again. I'm Priscilla, as Ginny mentioned, and we can go ahead and get started. So what I'd like to talk to you about today is, first I'll tell you a little bit about myself, occupational therapy, and how that ties in with vision challenges. I'll try not to spend too much time there, but talk about it enough to lay the groundwork for what I'll talk about afterward. And then I'll talk about different adaptations that you can make if you have vision challenges. And I heard some people in the audience earlier speaking about specific diagnoses, like if I have glaucoma or I have macular degeneration, etc. And I actually adapted my presentation this year to not detail the adaptations specific to each diagnosis, but instead in different aspects of the challenges that you might experience. So it will still relate to challenges that you might have if you have certain diagnoses, but I won't be talking about each one specifically. And that will be it. So a little bit about me. I grew up and went to school in Indiana, and that's where I got my Master of Science in Occupational Therapy. That's what MSOTRL represents. And then after that, I worked as an occupational therapist for about 8 years. All of that time was working with older adults in various settings, from skilled nursing facilities to home health to Horizon House. And then after Horizon House, I made a little career switch to user experience design. And that's me with my dog who is from Mexico and does not seem to enjoy the cold or the rain. So what is occupational therapy? It is a skilled healthcare profession that helps people essentially be able to live their everyday life however it is that they would like to spend their time. And occupational therapists work with people from a holistic perspective. So one way that we think about that is looking at a person from like the personal elements of how they see and view the world, and their physical condition or their mental or cognitive health. And then we take that and pair it with their environment. And that might be your apartment, or that might be Horizon House, or that could be the broader community. And that all depends on what occupation we're working with you on, with occupation representing any meaningful activity. So any activity that you care to be able to do, we call that an occupation. And another way of putting it is that occupational therapists are creative problem solvers. So we take the puzzle of what's going on with you and what you'd like to be able to do and all the circumstances, and we try to figure out something that works for you. And so next I have a question to pose. Maybe just think about it for now, and if we have time later, we can talk more about it. But I'd like you to think about how your vision has changed over time. And hopefully what I touch on in the next couple of slides will align with what you've thought of. So a lot of changes can take place with the eye and your vision as you get older. First, I want to talk about some age-related changes. So these are changes that you might experience even if you don't have a specific diagnosis of cataracts or glaucoma or something else. And these changes include a narrower field of vision, decreased visual acuity, and visual acuity is what the eye doctor often is checking when they ask you if you can read the letters on the wall. You can also experience more difficulty seeing clearly in low light situations. You may have more difficulty seeing near and far. There could be a loss of color sensitivity, so more difficulty distinguishing different colors apart. There can be more challenge with light and dark adaptation, so that might mean if you walk into the bathroom and turn on the light, all of a sudden your eyes take more time to adapt to that light that you just turned on. There can be increased glare sensitivity, and glare sensitivity we'll talk more about later as well, but you can think of it as like when bright light is shining into your eyes, they're more sensitive to that. And also decreased contrast sensitivity, so more difficulty distinguishing maybe the edges of objects or distinguishing separate objects if they're close together and close in color. And that brings me to talk about low vision specifically a little bit. And low vision is specifically vision impairment that cannot be corrected by regular glasses, contact lenses, medication, or surgery. And in other words, that's also often irreversible changes to your vision. Low vision, a component of low vision is also that it interferes with the ability to perform your everyday activities. And that's where occupational therapy comes in. If you recall earlier, I had mentioned that we work with people to be able to perform their everyday activities. So if you have low vision and that's stopping you from doing things that you need to do, hopefully occupational therapy can help a little bit. And here are some ways that having vision changes or low vision might impact your everyday life. And maybe some of the things that that you thought of earlier when I asked you about your vision changes have impacted some of these activities. So these could include anything that you do for recreation or leisure, whether it's gardening or hiking or anything in between. And what we call activities of daily living, that's what ADL is. And those are your self-care activities that you do every day. Maybe it's a little harder to get dressed or see tiny buttons on your clothes or find the right clothing item in your closet. Low vision can also impact what we call instrumental activities of daily living, which are more complex everyday activities that are still important for your independence. That might include writing a check, paying your bills in general, telling what time it is, looking for items around your home or wherever you are, using your phone, managing your medications, or preparing a meal. And this is this comment about low vision being an even greater threat to independence than hearing loss is kind of my attempt to tie together my talk on Wednesday about hearing loss to today our talk about low vision. Both can have a significant impact on a person's independence and vision loss even more so. So what can occupational therapists do if working with somebody who has low vision? According to the occupational therapy research, the most effective occupational therapy interventions are providing education about low vision conditions, working with individuals on the use of low vision devices, and also compensatory strategies. So low vision devices, and also working out different ways of doing things, perhaps workarounds to adapt to your vision loss, and also providing low vision resources. And then on a case-by-case basis, we may work with people on problem-solving specific tasks and different ways of doing them, or work with people on using other technology, not necessarily specific to therapy or healthcare, but just products on the market. Should I wait for the drilling to stop? Okay, I will go ahead. So let's move on to the actual accommodations that you can make. Actually, I realized that I forgot to do something. Sorry about that. I prepared something for you to get an idea of what different eye conditions look like and how they can affect vision. So this nifty website shows you how vision changes for each of the 4 leading causes of low vision. So for a person with age-related macular degeneration, your vision might change from something like this to something like this. So here, there's some dark splotches in the central area of your vision. And it may be different for every person, but this is gives you a general gist of what it may be like. For somebody who has cataracts, your vision may change to be more blurry, or lines might get warped, or you may have more difficulty seeing in the dark. So your vision may change to something that looks like this. For somebody who has diabetic retinopathy, your vision may change from something like this to something like this. So a lot of blurriness and also some dark splotches as well. And of course, again, this will depend on the person. And for diabetic retinopathy, it can depend on the day or the time of day as well. And for somebody who has glaucoma, your vision may change from something like this to something like this. So a loss of your peripheral vision. And I'll share this link to this website after the presentation so you can have access to it as well. Back to where we were. So, principles for accommodations. I'll talk about accommodations that you can make to adjust lighting, size, contrast, and to adjust for the use of other senses to compensate for your vision changes. First, we'll talk about lighting. And for lighting, I choose to talk about this one first because it's a pretty it pretty broadly affects people who have vision changes. It's related to regular age-related changes to the eye, and also a number of the most common eye conditions. So one thing that, and for a lot of those conditions, you find that you need more lighting and more focused lighting to see what you're working on and do what you need to do. So one thing you can do for that is to create for yourself more or less like a lighting station. So set up a space where you can sit comfortably, you have good lighting, and good lighting means really bright lighting. What I found was that light bulbs that are labeled as daylight bulbs are good for people who need more focused and bright lighting. So on the packaging, it might say daylight bulbs, or it might say 5000 K as the color temperature. And what you would look for is a light bulb that is at least 5000 K. And with that lighting, you want to adjust it so that it's directed at whatever you're trying to read or focus on. And this is not a very good image, but it's an image of a package of a light bulb, so you can get a sense of what it might look like if you see it while shopping. Other adaptations that you can make for lighting, the first item I actually already mentioned a little bit. You want to focus the lighting on what you're reading and what you're working on. So something that can be useful for that is a lamp that has a gooseneck or a flexible neck or arm. And also, dimmer switches on your lighting could be helpful because, like I mentioned earlier, your lighting needs might change throughout the day depending on your eyes or depending on the time of day. So if you have dimmer switches on your lights, you can adjust it to what's best for your vision and your needs. Another aspect of lighting is glare sensitivity, which I mentioned a little bit about earlier. And glare sensitivity can also be related to many of the leading causes of vision changes: macular degeneration, diabetic retinopathy, cataracts, and age-related changes. And it means that you experience a loss of visual acuity, or you have more trouble seeing when there's really bright lighting, such as when you're outdoors on a really sunny day, or if it's a very sunny day and the sun is shining, coming right through your windows in your apartment. You can also experience glare from mirrors in the bathroom, or even just shiny surfaces in your apartment if you have a smooth, reflective counter or tabletop. Adaptations that you can make for glare sensitivity are to make sure that you have curtains on your windows and lampshades on your lights. And then there's a little bit of nuance to that, right? Because we just talked about needing light, but also curtains block the light. So there's a little bit of experimentation in finding the right type of curtain, and also experimenting with the type of lampshade. For example, you might choose a white lampshade over a black lampshade to let more light through. And you can also experiment with the arrangement of your furniture to reduce glare on your screens, such as your televisions or your computer monitors. And there's a couple elements to that. You don't want the light to be reflecting directly off of your screen is one aspect of it, but you should also think about where the light is coming from when you're sitting down to look at your screen. So if you wouldn't want to set up your living room to where when you're watching TV, the sun is shining through from behind the TV. So there's no glare on your TV, but there's a lot of glare coming in from the window. And then in terms of being outside, something you can consider is wearing a hat on a sunny day. It sounds simple, but hopefully it can make a difference to the light that's shining down on you. I've come across a couple of articles where they talk about yellow light glasses as well, but I think the jury is still out on that, about maybe it helps some people, not others. Maybe more research needs to be done on it. And I wanted to show you a little clip from this video from this person who has an eye condition called Stargardt disease, which apparently presents similarly to macular degeneration. And I think he speaks well to the fact of how he needs more light, but also can't have too much light. Let's see if this works.
Now, I should also mention that my vision is much better in bright conditions, although everything about my vision is kind of a contradiction. Even though I need bright light to see things, I'm also slightly photophobic, which means bright light is painful or is sensitive. My eyes are sensitive to bright light. So if I go outside on a super bright sunny day, it's painful and I need sunglasses. Meanwhile, if I'm inside, bright light is awesome. Bright light is my friend. I need some extra task lighting to see what I'm trying to do. So because of that, I don't do well in the evening times out and about. If I'm trying to walk through a parking lot or something like that, it's very difficult for me to do that in the evening times. And that is when I pull out my cane and I use my canes. We got a whole bag full of canes over there.
Yeah, so hopefully he gave you a little bit better of an idea or helped to tie together what I was trying to explain. So next, let's talk about accommodations that you can make to adjust for needing to make adjustments for the size of something. And today, I'll primarily be talking about the size of text and magnifying that, but other situations, there may be other situations where size is a factor as well, such as managing medications, for example. One thing you can do is to make adaptations that eliminate the reliance on the text altogether. I think this might seem a little bit dramatic to talk about first, because I don't think we want that to be the first solution. But in some instances, it's better to just eliminate the reliance on text. And a couple examples of that are perhaps in the shower, if you have soap or shampoo bottles that are very similar and it's hard to read what's on the bottle, you can transfer your shower gels and your shampoos to a pump dispenser and make sure that the pump is easily distinguished from one to another. Or you can also use a rubber band. That's a little bit more simple, to just tie a rubber band around one bottle and remember which one has the rubber band and which one doesn't. You can also, another way to accommodate for needing different size text if you have vision challenges, is to adjust the settings on your devices. For example, your computers, your smartphones, your tablets. If you're not already familiar with this, more and more so, devices are having a lot of accessibility settings. So if you go into the settings of your phone or your tablet or your computer, you can make adjustments for larger text or higher contrast or different brightness. Or I looked on my phone this morning. You can also, there's a setting to use it more or less as a magnifying glass. And also there's a setting for it to read the text on the phone to you. So yeah, whereas maybe in the past you needed to have a separate device to do that, more and more so now, if you have and use a smartphone, it can do that for you. And if you don't use a smartphone much, or if there's situations where a smartphone doesn't make sense, there's always the good old-fashioned magnifiers. And with magnifiers, there are many different sizes and shapes and types of them. There are illuminated ones and non-illuminated ones, which you may find one or the other helps you to see better or reduce the strain on your eyes when you're using them. A consideration about using magnifiers is to place the magnifier on what you're reading and then slowly move it around to kind of calibrate and find the right spot for the magnification. You may have different magnifiers depending on the situation, maybe one type for home and one for taking out with you. And that comment partly relates to the fact that for magnifiers, the more magnification you need, the smaller the magnifier is. So maybe a smaller magnifier is nice because it's compact and you can stick it in your pocket, but also it's not so nice because you can only see a little bit of the page at a time. Another consideration is that there are stand magnifiers that you can use for activities that require two hands, or if your hands or arms get tired from overuse. And here, you'll see the same gentleman from before talking a little bit about different types of magnifiers.
Now, one thing very important to remember regarding the level of magnification and the style of the magnifier. As the level of magnification increases, so the strength of the magnifier gets larger, the lens gets smaller. So this one here on my left side is probably a 2 times magnification, maybe a 1 or a 2 times magnification. This other one here on my right is a 10 times. And that's just the way optics work. Unfortunately, there's no way to get around it. So definitely something to remember. If you need a stronger magnifier, you're going to have to deal with a much smaller lens. So that's why I say that these large magnifiers that you can buy in stores like Walmart or Target, chances are for most of the people watching this video, they're not going to be strong enough. You're going to need to go
So let's talk about a little bit about contrast. Contrast sensitivity can also be related to age-related changes or specific eye conditions, and that refers to the lessened ability to perceive sharp and clear outlines of objects or detect small differences between shades and patterns. And one way that can manifest is that you have more difficulty distinguishing objects from the foreground and the background. So here's an example that I like to use to talk about contrast sensitivity. Does anybody have any thoughts or comments about how the contrast is in this bathroom? Somebody said the floor, and somebody said not great. So the floor, I would say, provides relatively good contrast within the room compared to everything else in there. And then in terms of the contrast being not great, I agree. everything is more or less white or off-white or silver color, and I think that makes for a nice aesthetic in terms of looking at, but it can make things challenging if you are experiencing vision challenges. So here's an example of a bathroom that uses better contrast. You'll see that the grab bars are black compared to everything else that's white. Also, the trash can next to the toilet is black, which hopefully can help with, avoiding kicking the trash can by accident. But going back to the previous image, there actually are grab bars in this bathroom, but they're kind of blending in. There's a silver one on the shower wall that's blending in with the shower door frame. There's another silver one that's blending into the wall by the toilet and also being covered by a towel. And here's another example of how you could add contrast to make things easier to see. So here you'll see a gradient of grab bars, and maybe you don't necessarily need a black one, but there are some other options between black and white for you. And next week, we'll talk about patterns a little bit. And patterns are also, I talk about patterns also in the same category as contrast, because patterns tend to draw in objects and make them difficult to find. So, for example, here's a room that has a lot of patterns, and if I were to ask you to find a book in this room, maybe you can find one, maybe you can't, but even if you can find one, there's a lot more competing for your attention while you're looking for this book. And similar to the topic of patterns, organization is something that you can consider when adapting your living space for vision challenges as well. Because the way you organize your things is more or less creates sort of patterns in your room. If you have things kind of jumbled together, then it makes it a little bit more difficult to find what you're looking for. Yeah, and then on the right, if it's more organized, you can at least kind of reach toward the area of dark colors for a dark shirt, or distinguish where your shoes are. And the last category I'll talk about is use of your other senses. So, like I mentioned earlier, a lot of the age-related changes to the eye and a lot of the changes that happen to your eyes with different eye conditions are irreversible. So, in some cases, you have to figure out ways to work around it. And there are many different types of devices that people have come up with over time to help with this. This, for example, is a collection of devices that will talk to you so that you don't have to see the numbers. So a talking timer, a talking calculator, a talking blood pressure meter, also talking clocks, a talking blood glucose monitor, a talking scale, talking thermometer. And I found this selection the most interesting. There's a talking Bible device, a talking color identifier, which you point the device at a color and it will tell you what color it is. And also two talking label wands. So the label wands are interesting because they work with stickers, and you put a sticker on something that you want to label, you touch the pen to the sticker, and then you talk into the pen to leave yourself a note for what that label is for. And earlier I mentioned adjusting the accessibility settings on your phone to have it read for you. But here is another option for having your phone read things for you using an app called the Live Read app.
You launch the app, it just launches your camera, and all you do is point the camera at printed text. It reads it out loud.
How does it work? The pharmacy will attach a small electronic tag to your prescription container. It has the same info.
So very simple, point the camera, reads the text. But like I said, Ryan's added in a couple of extra features. Number one is if you tap the screen with one finger, that stops the reading. But we also have some other gestures. If I swipe to the right during the reading, it will jump to the next line. If I swipe to the left, it will jump back a line.
How does it work? The pharmacy will attach a small electronic prescription container. The pharmacy will attach a small electronic prescription container. Same info as.
So there's an example of that, and this video also reminds me that there are settings, I don't know about on this app, but on the phone there are settings that can adjust how quickly the phone talks or the pitch that it talks in, if you hear some sounds better than others. And here's one more. I believe this is the last device I have to show you. This one is a device that is not connected to your phone or anything else. It's its own device, and you can point it at different text anywhere you like, and it will read it out loud for you.
Very, very well. Both devices will take a picture of a full document or a street sign or something and read it out loud start to finish. Both devices also have a way to fine-tune that reading area and read certain selections of text. Think of the example, you're reading a menu. You don't want to read the whole menu, you only want to read what kind of salads they have. Both devices can do that.
He was talking about both devices, and what he was referring to is that there are two variations of this device. One is a handheld device that you hold it and point it at things, and the other one is similar, but it's a smaller device that hooks onto the side of your glasses, so you don't have to hold it. It just looks wherever you look. And this is an extra device that I threw in. I couldn't find a good place to work it in easily, but I had heard that some people at Horizon House may be using eye drops for their dry eyes, and I don't know about you, but if I try to give myself eye drops, it's not the easiest thing to do. So there actually is a device to help with that if you're having trouble with it. It's a little tube-shaped device that goes over your eye and has a spot for you to put the eye drop bottle in so that you have an easier time with aiming the eye drops. All right. And I believe, yes, I believe those are all the strategies that I had prepared to talk to you about today. I wanted to close on a note that vision affects every person differently, and also it often does not present in isolation. So the strategies that we talked about today theoretically work well for what they're intended to assist you with, but because every person is different, and maybe some people have other conditions like high blood pressure or heart failure or diabetes, all of that kind of comes together to influence what does and what will and won't work for you. So it takes a little bit of experimentation, and also if you need help, that's where an occupational therapist can come in and try to support as well. And for the resources that I shared with you on these slides, they are resources to connect you with assistive technology being the various devices that I showed you. And specifically, Washington has a program where you can borrow some devices for a small fee, maybe $10 or $20, and you can borrow them for 3 weeks. So you can test it out before deciding to buy it. For some items, maybe it makes more sense than others, because some items, maybe it costs, $30 to buy, but others can be a couple hundred or several hundred. So you may find it helpful to try it out before you take the plunge.
So Priscilla mentioned this resource when she was here the other day talking about hearing. And so our committee will contact the University of Washington to ask them to bring over some of these devices to show us, because she said there's both hearing and vision devices that they can lend to you at a low cost. So you can try them out for, say, up to 3 months, and then you could decide if you wanted to buy those. And I think that people would appreciate seeing those devices. So we'll arrange for that to happen. Thank you.
And that's all I have prepared. If you have any questions, I'm happy to try and answer them. Otherwise, thank you for your time.
Yeah. So if you came today with a specific question and it wasn't answered, perhaps you might want to ask that question now. Or, yes. Sorry about the noise.
Well, first, I wanted to say you were amazingly patient through all of this noise. I felt like I was in the middle of a psychological experiment of some sort. But the information was terrific. But because of the noise, it was very hard to process. So is there any way we could get the slides or somehow the content of what you were talking about? It'd be great.
You can send those to me and I could send them out to people.
Yes, I can send the slides to Ginny so that anybody who wants them can reference them.
And if we want an occupational therapist to come to our apartment and assess things, how do we work that out?
As far as I know, it always starts with a referral from your doctor. So I would contact your PCP and say, I would like a referral to occupational therapy. And then if you specifically are looking for one to come to your home, you can ask whether you qualify for home health or not. Because then if you request a home health occupational therapist, they'll come in. But if they say, no, you have to go to outpatient, then you'll have to go to them. Does that answer your question?
Well, so, yeah, we had somebody here through Infinity Rehab once.
That was me.
No, there was another
Oh,
woman.
someone else? Okay.
Was it before you, I think? Anyway, she was excellent and very helpful. But my conditions have certainly deteriorated now, and I could use some assistance. I guess the final question is, do you know, There's a company, I think it's called MicroSun, that advertises a lot of very bright lights that you can buy, or bulbs and so on. Do you know anything about that set of products?
I do not.
Okay.
I have not looked
All
at
right.
them.
Well, thank you very much. It was very helpful.
Thank you.
Other comments or questions people have? Here, Mona, here, let me get you the microphone.
And also one more thought about Andy's question too is that if different occupational therapists have different levels of experience working with low vision, and so if you are really interested in one that focuses on low vision, I believe there is at least one, maybe multiple websites where you can look up clinicians who have the low vision certification. So if you are specifically looking for somebody who knows extra much so about low vision, you can try that route.
What are the best colors to paint your walls?
What are the best colors to paint your walls? My first response is it depends. That is a very frustrating response, but I think it depends on a number of factors. The first thing I can think of is what your furniture looks like, or the counters in your home look like. I would choose a color that provides contrast for you to see the things that are laid out in your room compared to the wall. So if you have a lot of, like in Anderson Hall, for example, the chairs are dark green. So I would want the walls to be a lighter neutral color.
So it's the contrast that's important.
Yes.
Similarly, what's a better color for the surfaces, like that you're going to be using to chop on for food?
For that, it also goes back to contrast. You bring up a good point there. One adaptation that people make for chopping food is to have different color cutting boards. So that if you're cutting a peeled potato, maybe you use your darker color cutting board. And if you're cutting, what's something dark? Beets, then you use your white cutting board. You didn't ask about this, but if you have trouble with pouring things, because like seeing when something is full, right, little tricks for that are to pour over a tray or pour over the sink. Or if it's not a hot liquid, a common trick is to put your finger where you want to pour to, and once you can feel the liquid, then you stop pouring, if you don't mind your finger touching the liquid.
In our apartments, I'm sorry to ask so many questions, but in our apartments, the counters are all black onyx, which I find impossible.
Right. Black is probably a hard color for the kitchen. Is it also shiny as well? Yeah. So I think for that, you would want to consider a few things like the glare coming off of the shine and also the color contrast again. So is there a specific task that's particularly difficult for you to do on that counter?
I'm sorry, can you repeat that question?
Is there a specific task that's difficult for you to do on that counter?
Chopping food.
Okay, for chopping food, I would go back to that cutting board suggestion and to make sure you have a contrast between what you're cutting and the surface. And also if you could consider the size of your cutting board as well, because if you have a relatively small cutting board, then the black and maybe like the glare off of the counter could still be problematic. So I might put something down to cover a larger area of the counter as well, whether it's a larger cutting board or something else underneath it.
My little homegrown fix for the problem that you're expressing is to buy a set of plastic, basically, cutting boards that come in at least 3 different colors. They're all the same size and everything, which is fairly large. And I put them, and they live permanently on each side of my kitchen sink so that I can both see it and chop on it and then pick it up and wash it off. But they're pretty widely available these days as a set, typically of 3 with 3 different colors.
Yes, that's a great point. And they're light. The ones I'm thinking of are really lightweight too.
And very bright.
Yes. And also one thing I forgot to mention you could consider as well is in terms of lighting, because I focused on talking about the glare and the contrast, but if lighting is a factor as well, depending on the type of lights you have in your kitchen and where they're located and where you have cabinets, you could try having some task lighting. So if there's a cabinet over your counter, you can try the mountable lights to go under the cabinet. So wherever you're chopping, there's more focused lighting for you.
I was thinking about when you talked about the shampoo and the conditioner. When I stay in hotels, before I do anything else, I go in the bathroom and I take the small bottle of shampoo and always put it on the right and then the conditioner on the left. Because when I go in the shower in the morning, I take off my glasses, right? So I couldn't distinguish which was which. So I just have a habit. I go in a hotel room and I put the shampoo here and the conditioner there. And
that's a good habit. And I think you bring up a good point too, is about building habits in general. A lot of this probably doesn't come naturally or feel natural because it requires you to change the way that you've done things for, I don't know, 20 years, 30 years more. So I think something else to consider is to be patient with yourself and, try different things, but know that it will take time to figure out the new way of doing something and find the right trick for you.
other questions, comments? Well, what?
Any tricks that work?
Any other tricks that people have that help them? We have a reading machine in the library. If you're not aware, we have 2 machines in there that enlarge text, and you can adjust the brightness and the size of the text. And if anybody needs help using that, I'm available to help you learn how to do that. My mother called it a freedom machine because it gave her the freedom to read recipes and to get telephone numbers and things. It's a wonderful machine.
I have one more question. I have problem with shades, different shades of things. And how can I tell if the fish is cooked if I can't see the difference in its shade?
Oh, that's a good question. 2 ideas. I think I'll save what I think is the better one for last. So the first one would be, I haven't tried that color detection device that I mentioned in the presentation before. Maybe something like that. That's more of, I'm less sure about that one. But I did also see that there is a talking food thermometer. So maybe if it's no longer easy to tell by the shade of your fish, you can try to determine what the temperature is that you want to cook it to and use the thermometer to help you determine. Yes.
No, just. I was just going to say there's a huge variety of things you could do with modern cell phones. And I think it's worth our having a session just to go through those in detail. Because you said a lot of them so quickly, people wouldn't know how to implement them. So maybe
That's a
we
good
could do that
point.
sometime.
We've asked the Anne Marie to do a session just focused on people with hearing challenges and vision challenges, and we could do that again because it's really nice to have somebody sit next to you and help you try out your phone to see how things work. So we should ask maybe Anne Marie to do that again for us and others here, like you, who know a lot about technology. Thank you so much for coming and sharing with us.